Hello and welcome to the final episode from ID Week at the Boston Convention and Exhibition Center in Massachusetts. This is where infectious diseases leaders from around the world are meeting to try and solve some of the world's toughest medical challenges. ID Week is the joint annual meeting of the Infectious Diseases Society of America, the Society for Healthcare Epidemiology of America, the HIV Medicine Association, the Pediatric Infectious Diseases Society, and the Society of Infectious Diseases Pharmacists. I'm Katie Brace, and this is ID Week TV. In today's episode, we discuss compensation and advocacy for ID doctors, explore a new maternal vaccine for respiratory viruses, and take a look at career support for women in the field of ID. But first, Emily Blumberg from the University of Pennsylvania provides insight on solving the organ shortage crisis. Thank you so much for joining us.
Thank you very much for having me.
Are we experiencing an organ crisis nationally? And if so, what do we need to do?
Every year there's over 100,000 people waiting for organs, and there's additions on a weekly basis to that list and fewer people coming off the list. And so we're in this constant state of crisis trying to find organs for people in need. And these are people who have health crises that can kill them. And so they really need the help. There are a lot of reasons there aren't enough organs. For one thing, in the United States, organ donation is an opt-in, not an opt-out. For another thing, there are a lot of processes that make this more complicated in terms of optimizing the use of the organs, eliminating inefficiencies. But the way that ID people can contribute really is by trying to think of the safest use of organs for people who could transmit infections or might be considered a pool at risk for infectious diseases. And so we can help by considering how safe to make those organs.
So you touched on it a little bit in terms of the role infectious disease doctors can play in this. What do they really need to focus on in terms of making those organs transferable to someone who needs them?
Well, the first thing we need to do is understand the risks that an individual organ might convey. And so, for example, right now we're living in a world where we have a lot of deaths in the United States related to the opioid use epidemic. And there are many people who die of drug overdoses. And in some cases, those people are at increased risk for new infections with HIV or hepatitis C or hepatitis B. And so we need to understand as ID people how best to test these individuals and how to mitigate risk if they are infected. We also need to understand the risks that are associated with people being from other parts of the world where certain diseases are endemic, things like strongyloides. So we need to understand how to best assess donors for that and intervene on the recipient side if they get these organs.
Let's talk a little bit about kidney transplants, because you can have a living or deceased donor. So what's the plan to double the kidney transplant volumes by 2025, which isn't very far away?
Yeah. The first is to bring living donation to the forefront and to make sure that people understand that it can be safe to be a donor. We also need to use technology to expand our ability to use donors. For example, somebody who has a cardiac death and then the organs may be salvageable still with that, so technology will be important. And we have to stop throwing away potential organs that are potentially discarded because people are concerned about infection risks. And so that's, again, where the ID team comes in. So we do have a part in this, but it's such a complicated process, and there are so many barriers at every step of the way.
All right, well, thank you so much, Dr. Blumberg. We appreciate you taking the time.
Thank you.
Now, the doctors of the Mount Sinai Health System are leaders in treating, preventing, and researching the wide variety of infectious diseases, including COVID-19, bacterial, insect-borne, HIV/AIDS, and sexually transmitted diseases, to name a few.
Mount Sinai Hospital and the Icahn School of Medicine was really unique. Unlike other university-affiliated medical schools where research was derived from the bench to the bedside, we often would identify from the bedside and take to the bench. During COVID, we saw marked health disparities among the different boroughs in New York City. And this has led us to initiatives opening clinical trials system-wide so that all individuals have access to clinical trials rather than expecting people who live in the outer boroughs to come into the city.
Education is key. And what that looks like for us at Mount Sinai is actually meeting the people where they are. We're in schools, we're in churches, we're in community-based organizations, we're handing out information, and we're actually taking the time to talk to people and address their concerns. So while we're out there educating, we're also listening.
I'm delighted to be joined by the president of IDSA, Dr. Carlos Del Rio, Distinguished Professor of Medicine in the Division of Infectious Diseases at Emory University School of Medicine. Thank you so much for joining us.
Happy to be with you, Katie.
So let's talk about the initiative of the Infectious Disease Society of America in improving compensation and advocacy in the infectious disease workforce.
It's really around increasing the value of infectious disease clinicians. You know, one of the problems that we have is that a lot of the work that we ID physicians do is uncompensated work. You know, the hospital calls and says, we need to do this, we need to do that, and nobody compensates you for that. If you add to that, in general in our country, we tend to overcompensate procedural specialties. So if you get a surgery, if you get an endoscopy, if you get any procedure, the physicians make a lot of money. And we tend to undercompensate cognitive specialties. So if you are the ID physician who has to review, you know, a long history and have to spend a lot of time with the patient talking and trying to develop a diagnosis, et cetera, that's paid very poorly. So that needs to be corrected. So there's issues around increasing the value of ID, the recognition that there's things we're doing that need to be compensated, but there's also about really shifting that paradigm of, you know, of trying to not undervalue and undercompensate the cognitive specialties.
So in your mind, are there any practical steps that can be taken to improve the compensation?
The first step is to be heard, is to have a seat in the table, is to be open, is to have discussions with some of the leadership at CMS, at AMA, at the different organizations that really set the values and set the reimbursement for different things that we do. And having them listen to us and hear us is the first step, and that's where we are right now.
And when you're talking about contributions, it makes me think of PEPFAR 20 years in. What's the biggest achievement?
You know, PEPFAR is I would say it's a program that all Americans should be very proud of. This is the most important and the most impactful global health program. And what PEPFAR has done is not only has it saved millions of lives, over 25 million lives, that saved millions of children from getting HIV. So we need to be clear about the realities, and we also need to, call our congressional representatives, call our senators, and just tell them to reauthorize PEPFAR.
Final question for you. When we're talking about PEPFAR, what's the next pillar or challenge to conquer?
PEPFAR is moving into now tackling other issues like hypertension and diabetes and multiple other chronic problems. The PEPFAR platform is being used to then build other programs that will do care for more than just one disease. We also need to talk about sustainability, right? How do we start transitioning the program from an emergency program to a permanent program, and how do we get countries to be more and more involved and eventually take ownership? And that is happening, but that's a process. You can't just turn off the light and pretend that the countries are going to be able to take it over. It's a process that needs to occur. It's almost like landing a plane. You have to do it, you have to do it in an intelligent way in order not to crash.
A lot of work to be done. Thank you, Dr. Carlos Del Rio, for taking the time to talk with us.
I appreciate being with you.
Next, like many divisions of infectious diseases, University of Louisville had to adapt to tackle the COVID-19 pandemic. But their comprehensive expertise and versatility allowed them to provide essential solutions to some of the problems the pandemic posed. Let's take a look.
We will always have new pathogens and we will always need new treatment. It's an evolving field, and I love that about ID.
This is a specialty that is comprehensive, that can be versatile to accomplish a great need for the community. When COVID first hit, testing was absent. The University of Louisville Division of Infectious Diseases were able to receive a sample of the first patient with COVID-19 from Seattle.
We were able to use it to develop more models, techniques, or more diagnostic tools.
We had to find a swab so we could use our test.
I used 3D printing extensively in my research, and by the time we were done, we'd produced over 12,000 test kits.
We were able to respond to the epidemic and help the community. The division here is an excellent place to learn because of the patient care, the teaching, and the research.
We have attendings that come from different areas of the world, and their final goal is to treat the patient appropriately.
Now, RSV is a leading cause of lower respiratory tract illness in young children. Could a new vaccine for pregnant women be the answer? Here to discuss, our PIDS president, Dr. Buddy Creech from Vanderbilt University Medical Center, and Dr. Amy Law from Pfizer. Dr. Creech, let's start with you. The current impact of RSV, big talker, clinically and economically.
This is an incredible time for us in human history because for the first time, we're going to be able to prevent one of the most significant respiratory viruses that we see in kids and adults. Every year during the RSV season, about 500 children a day are admitted to the hospital, and about 500 older adults are admitted to the hospital with the equivalent of RSV pneumonia. We can now begin to prevent something that costs tens of billions to our healthcare system. This is a good thing to celebrate.
And let's bring you in, Dr. Law. So there's a recent study about the effectiveness of the vaccine. What were the big findings?
The big findings that we had was that with the maternal vaccine, we can prevent as many as 200,000 cases, RSV cases, and among infants, less than one. And that's associated with a savings of up to $800 million. And this is with the clinical efficacy of almost like 69% against severe RSV disease among infants.
And my understanding is that the finding is pretty conservative.
Of course, yeah. This is based on modeling approach, and so with every model there are a number of inputs and assumptions. And some of the inputs, such as the effectiveness of the vaccine, this is based on a study that was conducted during the pandemic, and when it's out in the real world, the effectiveness may actually be higher.
Which would be great.
Yeah.
And Dr. Creech, from your research, when do you think vaccine will be available to a whole wide spectrum of folks that you touched on?
There's a vaccine or a prevention for almost everyone. We can vaccinate moms late in pregnancy, and that provides protection not only for them, but more importantly for their babies as they're born. Secondly, we can give a monoclonal antibody called nirsevimab to the infants during RSV season and provide protection for maybe at least as long as 5 or 6 months against pneumonia from RSV. But then the ones we don't want to forget are the grandparents, the ones who can get a vaccine themselves to not only protect them against RSV, but maybe most importantly to protect their grandchildren. So what we're effectively doing is we're protecting the individual, but we're also trying to build a cocoon around them. So except for those of us who may be in that sweet spot of infancy to retirement, we don't have anything yet, but for pregnant persons, for infants, and for the elderly, now's the time to be talking to your provider about how to prevent RSV.
Well, a good sentiment to leave this segment on. So Dr. Creech with Vanderbilt, Dr. Amy Law with Pfizer, thank you so much for being here with us.
Thank you.
Thanks so much.
Next, we take a look at what the Center for Emerging Viral Threats at LSU Health Shreveport is doing to address the need for faster detection and processing of COVID-19 and other viruses.
In November of 2019, they begun to hear about viruses or an infection spreading in Wuhan, but never had an idea that it would end up becoming a major pandemic. In the early days, there were really a handful that came together to realize what would we need to be able to do PCR-based tests. The operation became so large, we ended up doing testing in 62 of the 64 parishes across the state of Louisiana.
In preparation for January 2021 to have a vaccine available in the community, we relied on our strike teams and the people that we had working with us and more.
We vaccinated over 133,000 people here. I believe we've vaccinated more than 33% of the people who have been vaccinated in Region 7 of Louisiana. We did everything we could to get out in the community.
All of the infrastructure that we've put in place through testing, through surveillance, through research, will put us in a much better position when and if another virus or infectious agent crashes into us again.
And now we take a look at career support for women in the field of ID with the Women in ID Breakfast and the art and science of being an ID chameleon session.
We started the Women in ID Breakfast back in 2015 when we were in San Diego. It came out of work between Chris Bryan and Wendy Armstrong and the need to have women come up, especially in looking for a job, how to do negotiations, how to, even microaggressions at work, and to start a networking activity. It actually blossomed in 2019, where we overflow a whole ballroom, and then they realized the power that we had. It's a way we're role models. There's more women in ID. We're almost 51%. There's been an equity. JID article in 2016, we were less women, for example, in the conference, in the program committee, in awards, and there's been an intentionality to have more women there. And that has paid with the current numbers that we have, that is like 50%. This year we have an amazing program where the 4 chairs are women. And this morning we have Women in ID, and for ID Buckbow, we have the ID girl on the theme of Barbie.
So the art and science of it is that all of us as ID physicians have an incredible skill set that oftentimes we don't realize how widely it spans. We know we're going to taking care of patients who do or may have an infectious disease, but we learn so many other skills in our training and in our daily work with patients. We learn about treatment, we learn about prevention, we learn about how systems work, and we learn about leadership as well. And to be a chameleon, to me, is realizing all of those different hats that we can wear, choosing the ones that give us the most excitement, and really making that become your passion with your everyday work.
Yeah, so I think one of the things that's really critical is to think about the fact that you can have an impact in many different ways, and that you can have an impact in academic medicine through teaching, through mentoring, through research, and also obviously through patient care. But I think in terms of thinking more broadly about a career, there's other ways to have an impact, and that can be through industry and thinking about how do you affect broad swaths of populations if you can help develop medications that could help a lot of people.
Yeah, I think healthcare is probably pretty late to the game as far as incorporating coaching in faculty development and the overall wellness and well-being of their employees. So it's really something that I think is a burgeoning field. So there's 2 ways we can look at it. One is what are coaching services that are being offered to women in ID, women in medicine, and not even just women, but minorities and other individuals who are experiencing challenges in the workplace. So that's one thing to think about. And then the other part is that for those who want to explore more, what are some avenues to be able to learn more about how to become a coach, so that then being in the field and being a coach kind of have an inside perspective onto those unique challenges and experiences that people are going through.
It's sitting back, thinking about what expertise we have to offer to people in the hospital, in healthcare, and
way beyond healthcare as well. And that's where our knowledge can help people beyond what we would ever think.
Really thinking about what it is you want, what is your why, so what drives you, what brings you fulfillment, what makes you happy, and then really starting to go and chase that.
One is, is be intentional, be there, be a mentor, be a sponsor. So one of the things this year is sponsor her and invest in her so we can be stronger and ever better.
Thank you for joining us all in Boston as we discover the science only on IDWeek TV. That's it from IDWeek TV for this episode, but you can watch all our content in the following ways. On screens at the Boston Convention and Exhibition Center, in select hotels, on the IDWeek meeting website, and of course, find, share, subscribe, and like on social media. Have a great day.